dear friends, dear subscribers, and for those who are watching my videos, but I don't know why they fail to subscribe it. I once again request all of you to please subscribe my video. So in my series of emergency management, today I have come with one of the another very common emergency what you receive in emergency department is about the burns patient. Now this burns is an injury that is caused to the skin that can be because of fire or chemical or electricity or hot water, that is called a scald injury. I will not go into the detail of the burns. I will just tell you about how you can manage the burns in the emergency department. First thing, important thing is, if any person who has sustained burn at the home, what they can do at the home is they should put the burn area under the tap running water. Don't use lukewarm water or the cold water. You put your, say if the burn is there in the hands, then you have to put the hand in the tap running water for at least for 10 to 15 minutes. So what it will do, it will reduce the effect of the heat on the skin and will reduce the difficulty what is going to arise. So this thing is what you can do at your home. If the burn is small, you can wash it with running water, you clean it with sterile pad or cloth, then you applied antiseptic cream, Silverex or Burnol, the cream is available that you can apply at home. But if you can't manage the burn at home, or if the burn is more, then immediately you should rush the patient to your nearest hospital. That is very important, because giving first aid to this patient is very important to reduce the morbidity and mortality of this patient. So they have to immediately rush to the hospital. So once you are there in the emergency department and you see that some patient of burn has reached the emergency, you receive the patient and then shift the patient to the emergency cot. And then first immediately you try to measure the blood pressure of the patient, because many times this patient go in the state of shock because of excessive loss of fluid. Meanwhile, ask sister or ask somebody to open a thick bore IV line, use green or grey cannula. You can use it in the cephalic vein so that it remains there for a longer time, because IV fluid management in the burn patient is very important. Here I am talking about the flame burn injury that is sustained by the patient and has come to you in emergency department. So what various thing you can do is, you receive the patient. First thing is, you just open one IV line to the patient and start with some fluid, say normal saline or the ringer lactate. Then you immediately assess the patient that what degree of burn it is, what extent of burn it is. You must be remembering the rule of 9 that will tell you the what percent of burn the patient has sustained. I will, in my further videos, when I take burn specifically as a whole lecture, I will tell you each and everything about the burn patient. But here in the emergency department, just have a quick look the what is the degree of the burn, what is the percentage of the burn, and how much area is involved is very important. If in a child, if it is more than 10% burn, the child should be hospitalized. Or if the adult, if he is having more than 15% of the burn, that this patient needs to be hospitalized. And first important management of burn patient is the management of the fluid management, because if you hydrate the patient immediately, you can reduce the morbidity and mortality. Meanwhile, ask casualty medical officer to do the medical legal formalities of the patient, but this should not come this should not be in the hindrance in the treatment of the patient. Then if you are not able to find the IV line, might the patient has come to you late, you immediately do venous section and or cut down what is called venous section and have access to the IV line. I repeat again and again, please have a good access to the IV line as early as possible as you can. Then you put one, if the percentage of burn is more, you try to put a Foley's catheter and you measure the so that you can measure the input and output charting. Now how much fluid you have to give to this patient is very important. So to give the fluid, we apply Parkland formula. Arkland formula. This is 4 multiplied by percent of burn multiplied by body weight of patient. Say the percent of burn is 20 and it is 40 and the weight is 50. So this will come around, you say 80 into 50. So this come out 4 liters of fluid. 4 liters of fluid is to be given to the patient in 24 hours, out of which half of the fluid you have to give in first 8 hours and rest of the fluid is you have to give in another 16 hours. So this Parkland formula, you should remember that it says the 4 into percent of burn into body weight, which you can very easily calculate in the emergency department, and you rush the IV fluid, and the best fluid to give in the burn patient is Ringer lactate solution or the Normus line. This fluid you have to give. Then you shift the patient to the minor OT for the proper dressing of the patient. For dressing, you can use a silver sulfadiazine that is available with the commercial name of Silverex. You have to, and the sterility has to be maintained. You have to maintain a proper sterility while you are handling the patient of burn in the emergency department also. I know after that the patient will be shifted to the burn unit, but at the emergency department this dressing and all you have to do. So apply the Silverex in whole of the burn area, then put a sterilized pad and do a proper bandaging of the area. So what you have done, you have to give an injection tetanus. Might be the there is not much role of analgesic in the deeper burn, but in the superficial burn and all, the analgesic in the form of diclofenac or better to give opioids, the tramadol and all, you should give to the patient. Then there is another role of a broad spectrum antibiotic. You should start immediately in the burn patient, because later on most of the burn patient die because of the infection. So this you have to take care. Give a broad spectrum antibiotic that covers gram positive, gram negative and the anaerobic infection. This you have to cover, you have to give in the emergency department itself. So I will just repeat, just summarize what I have just told to you. You receive the patient, you open the IV line, do proper fluid management of the patient, then do a quick assessment of the patient, what is the depth of the burn, what is percentage of the burn, then do proper dressing of the patient, put Foley's catheter, start broad spectrum antibiotic and give injection TT, injection analgesics in the form of opioids needs to be given to this patient. This is the management of the fire burn that you receive in the casualty department. Then for the chemical burn, sometimes the patient are exposed to the chemical. This body has to be washed very properly, so that whatever the residual chemical is there, that has to be removed from the body. If it is acid, you take some basic agent to neutralize it. If it is a base, you add some acidic agent to neutralize it. So that is specific about the chemical burn. Then another burn is the electricity burn. Electricity burn is when the person is exposed to high tension line, then he suffers from the electricity burn, where the patient along with burn is very important thing is to know whether the patient cardiac activity is going on properly or not. For in this case, besides you start the IV line, do proper treatment. What I explained earlier, the patient ECG is must, and see whether there is any change in the ECG of this patient. If the changes are there, then proper treatment has to be given for to control or to stabilize the heart of the patient. So the specific is you have to look for the cardiogenic effect of the burn. Then you have to see what high tension injury it has gone. The basic when the patient comes in the contact of high tension where it is very deep injury. So finally you have to shift the patient to the burn unit under the care of plastic surgeon preferably. This scald injury is the hot water. This is a very common injury that is seen in the children, in the or females who while they are that cooking food. Same case, if such injury is there at home, you put that area under the running water so that the effect of heat is gone off. Then you apply some. There's silver sulfatizing ointment is available. You have to apply. Rest of the management is same what I have told about the in case of the fire. So this is, I think, with this basic knowledge you can manage your patient of burn in the casualty department. Later the early complication, late complication, that can be managed under the burn care unit. If this 1K unit is not available in your hospital, you might have to refer the patient to the other hospital. I think I have given some more idea about to handle the burn patient, and hope you like my video. At last, again, I would like all of you to please subscribe my video, and which will boost me and motivate me to come with so many other videos. Thank you very much.